Hi, I'm Kate Marie from Slow Aging. I'm here today with Suzie Hoitink, who's an absolute genius when it comes to skin rejuvenation, and she has a chain of clinics called Clear Complexions. And I'm a great admirer of Suzie's work because she's focused very much on best practice and being able to introduce the latest technologies to her patients or clients. Anyway, hi Suzie, hope you're well and thanks for joining us today. Suzie, tell me about your story. How did you get into this business?
So my journey really started when I was actually a teenager, believe it or not. So I had that typical teenage acne that everybody has, and that continued right through my teen years, but actually into my 20s as well. So I was one of those really unfortunate women who had adult acne. And then in my 30s, after having my two girls in my 20s, I developed hormonal pigmentation. So I hit 30, I had melasma, which is hormonal pigmentation, I had adult acne, and I was feeling really, really down about myself. And it even surprised me how much my appearance, so to speak, affected my self-confidence. So I was nursing at the time, so I had that obvious medical background, and I started looking around for what could help me. After having been through the journey of going through every lotion and potion, been at every doctor, I'd gone to dermatologists, I'd also been to the chemist. There was nothing I hadn't tried at that point. So as a nurse, I started looking for medical technologies that could help skin. What was fantastic about that was that it was at that time where skin rejuvenation was just beginning. And what I realised was there was a lot of technologies out there that could really help me. It's just that I couldn't get access to them. So in researching, I went to work for a fantastic cosmetic physician, and he was very interested in doing surgery. But what I realised when I was talking to the clients that I was treating was there was a lot of clients saying, if only I could get rid of the pigmentation or the brown spots, I wouldn't really need surgery. It's just that surgery was the only option. And I was like, well, did you realise there is technology that can do that? And that led me to looking at skin rejuvenation technologies, lasers in particular. And in 2005, I decided no one can do this better than nurses can. And we opened our first clinic.
Can you tell me a bit about the journey that you take women on once they decide to do something about their skin?
It's not so much a process, but it's just an understanding of what a woman or a man really want when they come into the clinic. I always think that somebody's picked up the phone maybe 1 or 2, 3, 4 times before they've actually made the phone call. There's a lot of emotion that happens before you come in to skin rejuvenation in general or to a clinic like ours. There's I shouldn't do it, is it vain, what are they going to do to me, will I look weird? There's a lot of emotions that happen. So before we even see a client, we have a really good understanding of that. When a client comes into the clinic, they have a consultation with one of our nurses. It's very in-depth. It's the most important part of the journey, as you call it, and that's a really good description of what happens. But when somebody comes in and has a consultation, that hour that they spend is the best education they will ever get in their skin. So we look at their skin below the surface, we see what damage has been done in the past, why their skin's in the condition it is now, and then what we can do about it in the future. And that's incredibly empowering. You see people who come in and they're not feeling particularly great about themselves. They have an insecurity that's insignificant probably to anybody else, but really significant to them. We're able to talk about it, identify why their skin's like that, and what we can do to give their skin the most positive outcome we possibly can in terms of skin health. And that has a short-term focus. It's very easy to do a quick fix treatment and make the skin look better for the next 2 weeks. But we have a longer-term focus. I want clients to look in the mirror in 5 years' time and know that their skin looks that good and is that healthy because they came to Clear Complexions.
So when in the consultation, do they fill out an in-depth form or?
Absolutely. So we need to know as much as we possibly can about them. So they'll fill out a very in-depth form about their medical history. It's very important we know their medical history, and that's why we only have nurses treating our clients. We don't have dermal therapists or beauty therapists. And it's for quite a few reasons, but one of them is that how we are inside reflects how we are on the outside. So medications and medical history definitely has an impact on our skin. It also has an impact on what we can do for a client's skin. So unless you have that medical background, you actually can put the client in quite a compromising position. And we need to know for safety, but also for efficacy for a result. So we need to know their medical history. We also need to know what they've tried before, what worked, what didn't work. And we also need to know their habits in terms of their lifestyle. You know, if we've got someone who surfs every day and has a lot of sun damage but wants to improve their skin, we know that when we do a treatment, they're going back out to surf again and in the environment. So we just need to know those things in order to tailor a treatment approach for them.
Do you use skin imaging, or how does it work?
For me, that's the most crucial part of a consultation, and we don't do any treatments on any of our clients.
Do you do that first, like in that first session?
Always.
You do the Canfield?
Always.
So tell me about Canfield Reveal. How does it work?
So when a client comes into the clinic, we do, as I said, a consultation, and that consultation goes for about an hour. The most important part of that is that we actually get to look at what's happening below the surface. We never treat anyone without doing this process. What we use is a Canfield Reveal, and they're exceptional because they look 2 millimetres below the surface, which doesn't sound like it's actually very deep, but it is. And what it does is it reveals to us how much sun damage they have, how much melanin accumulation is in the skin, how much vascular damage there is, and it can show us if somebody's got an inflammatory condition like rosacea or acne, or whether they've got simple sun damage, which has caused a degradation or a damage to their skin. And then it looks generally at the overall condition of the skin. From that, it's so crucial because it allows us to educate the client. They can see the condition of their skin below the surface, which helps to explain what's happening. And then from there, we can make some judgment on what's going to be the best way forward to get the skin in the optimal skin health going forward.
How much does it cost to get, so you do, if they come in and do a reveal test, what's the cost?
The cost of coming in and having a consultation is just $50, and it's redeemable off your first treatment. So really, it's the best money you could possibly spend on getting the best education in your skin.
Why do you think other practitioners aren't using skin scanning?
It astounds me every time why it's not universally done. It's such a crucial step, and as I said, we wouldn't treat anybody with even the most benign of treatments without having a look at what's happening below the surface. Every single day in every one of our clinics, there is a change in treatment course based on what we see below the surface. And it allows us then to come back and keep checking on clients' skin as well, so that we can do a reveal after a treatment journey, and we can have a look at the improvement in the skin. Why it's not done universally, I'm not really sure. I think it's one of these things that consultations is just viewed as a transactional process. It's a way of getting a client to do the treatment. It's not viewed as an education process, and for us, the consultation is all about education.
Suzie, I understand that you're using radiofrequency for skin tightening.
Skin tightening is becoming really popular. There's a lot on the market. Some work, some don't. Basically, radiofrequency, what it is it's like when you put down concrete, you put a mesh down first. You're very deep into the concrete, and that mesh really holds that concrete firm. We're trying to reach that collagen. Radiofrequency allows us to reach that collagen because it's very deep without interfering with the surface of the skin. So something like a laser or fractionated laser has an effect on the surface of the skin, albeit fractionated laser, minimal effect on the surface of the skin. But radiofrequency doesn't, it bypasses and it allows us to tighten up that very deep collagen. And that's the collagen that keeps our skin as tight and as firm as possible. So I love the modality. Most of our clients, as I say, would have it every 2 to 3 years. And it allows me to set and forget. I know that I've got that tightening happening. And so with my client, then I can just work on the surface, or relatively speaking, work in that mid-dermis and also on the surface of the skin.
What specific technology do you use?
Yeah. We use the Thermage CPT, which is the new technology that they've got. It's absolutely fantastic. They've just come out with new, what they call total tips, which allows it to be a lot more comfortable for the client, has more shots, so it's far more effective at yielding a result.
I've heard about photofacials. Is that a real term, or has someone made it up? What is a photofacial?
I don't think it is a commonly used expression. It's actually too broad, because photofacial really refers to any light-based treatment that has a rejuvenation effect on the skin. So if you were to now walk through my clinic, I could probably show you 7 or 8 different technologies that could be photofacials. I think it's a media term. Originally it was coined based around IPL. Because IPL was, I suppose, one of the very first photofacial, photorejuvenation treatments on the market. But as now we've got LED, we've got radiofrequency, we've got fractionated lasers, we've got IPL. So there's lots of different ways that you can have a photofacial. What's really important is that you tailor it for what the client needs. And the term facial, I think, probably dumbs the whole process down a little bit.
So Suzie, what's your favourite device? I mean, you've got all these machines surrounding you. Do you have a favourite?
I actually don't really have a favourite device, and I think that's a little bit like saying what's your favourite child. And the reason is I think my favourite device is actually a Clear Complexions nurse, because that's the one that's going to yield you the best result in terms of having somebody who will guide you through the process every step of the way and has your best interests at heart, has a duty of care to deliver to you not only a result but an enjoyable process and care long term, not just in the short term. And they have the knowledge. We empower our nurses over a very long period of time with a very robust education program. They have the knowledge to take you from having no experience or with skin rejuvenation at all to being able to engage in it on different levels to achieve the results that you're after in a slow and steady way. And so the best outcomes for clients is definitely when they not chase one particular treatment, but certainly when they come and get the right advice from the right people. In terms of what I personally like to do, I like to make sure that I use LED technology. We use the Omnilux Medical in here as frequently as I can. I really like our fractionated lasers, both our clear and brilliant lasers and our Fraxels, because they yield such dramatic results. And there wouldn't be too many clients in our clinic who every 2 to 3 years don't have a radiofrequency treatment for skin tightening. But as I say, that's just a small fraction of the modalities that we have in the clinics.